Okay, so I am a hand therapist and I suffered with carpal tunnel, so a very simple run-of-the-mill complaint that lots of people will suffer from in the world. And I'd had it off and on probably for between, I think it was pre-children. So I want to say probably the first time I spoke to Miss Fuller about it was 10 years ago, very informally, just in the side of a clinic. And then we arranged some tests because it was waking me at night and I just felt I had fuzzy hands on both sides. And then the test came back as a negative, and I thought I must be imagining it. So we kind of said, we'll just wait and see what happens. So I left it for a good number of years. And then it started to, I think it started to cause me more problems waking me up at night. So I had some repeat studies and it suggested I had it mildly. So I left it for a little bit longer until 18 months ago or 2 years ago, I suddenly realized it was waking me up every single night, particularly my left hand, more than once a night. I was having to shake them to get them to come back to life. And I suddenly realized I felt I was being clumsier. And I also think I was struggling to feel my hands during the day, which for my job is actually very important. So all of a sudden I started to not panic outwardly, but panic inwardly slightly, that my hands might end up like some of the patients' hands I get to see, where they have permanently altered sensation, lack of power, and they can't do what they want to do. So that's when I sought surgical solution, and I went by my GP like everybody else, had to jump through those hoops. They wanted to send me for more tests, even though I'd said I'd had those. I had all the, I hit all the criteria. I'd worn splints at night, which gave me no relief whatsoever. And in fact, I ended up taking them off overnight without even realizing it. So I got myself referred and went through all the official channels and waited to be seen, and then got listed to have my left one done first, because that was by far the worst, even though it's not my dominant side. I was offered an injection and I politely declined that because I'm not very keen on needles. And my professional experience of those is they give interim relief as opposed to a permanent relief. So I kind of politely declined that and decided I'd rather have surgery. So I waited slightly apprehensively, and then went ahead with the surgery. And I knew, because I say it to patients every day almost, what to expect. I knew how long the surgery took. I knew potentially how long it would take to recover. But when you're on the other side of it, it's slightly different. So I still listen to everything Ms. Fuller had to say to me. But it's a very simple procedure. Even the local anaesthetic, which I was, again, slightly nervous about because I'm not good with needles, I didn't even feel that going in, and that is no exaggeration. That was ever so smooth. The operation was all done with under 30 minutes, and that's including the local. And the only thing that was unpleasant about it was the tourniquet. I did keep asking Miss Philolove if she was nearly done and in fact could come down, because that's quite uncomfortable. That was the most uncomfortable bit. I chose not to look at it, not because I'm squeamish, because I love looking at a good wound. I just didn't wish to look at my own. And then it had a big bulky dressing on it for 48 hours. Mine was actually done on the first day of lockdown, and a friend very kindly picked me up, and I remember talking about her saying we won't go into lockdown, and I said I think we will, and then 4 hours later we were. And I remember my left hand not being too much of a problem, because I'm not left-handed, I'm very predominantly right-handed. I remember my son coming home from school. It was a little bit achy, but I didn't need to take any pain relief for it. I took the dressing down 24 hours later and just left the sticky one on. And I could actually use my hand quite well. Yes, it was a little bit tender and a little bit sore, but that same night I didn't have any tingling, any pins and needles. And that's the first time, probably for well over a year, that I hadn't been woken up with this hand, which was really, really lovely. Not saying that one wasn't a bit tingly, but this one was fantastic. And it did seem to improve that one for a short period of time. No logic behind that whatsoever. The sutures came out 10 days later, and I just had a sore palm. And it was the Easter holidays by then. We were in lockdown, the weather was lovely, and I even managed to go biking a little bit with my son. I freely admit I couldn't control the brakes very well, so I did get stuck on a couple of routes that he had to come and rescue us because I was clinging onto a tree with the other hand. So that was a little bit naive maybe, but the wound could take it. It was just sore, and I was back at work within 3 weeks, and I knew that this hand wasn't giving me any problems anymore. Yes, I couldn't lean on it because it was quite sore here. I had a little bit of what we call pillar pain, which is pain either side here from the release and how it affects the muscles really. And that came on much quicker than I expected. Actually, I normally say to people 6 or 8 weeks down the line, you might experience some pillar pain, but mine came on probably within a couple of weeks, and I was quite surprised about that. But it quickly went with me leaning on it. But it did take a good 3 or 4 months for me to be able to fully lean on that hand without it being slightly sore. But absolutely delighted with that one, and still am. And then I suddenly realised that this one was no longer waking me at night, but my right hand was. And again, that was 2 or 3 times a night. And I realised that over the summer holidays, and I just thought, gosh, this is ridiculous. And all through the day, I'd be going like this, not deliberately, just because you have a slightly funny sensation in your fingers. And I found myself doing that just to see if I could feel them. So I chose to have that one operated on, and I had that one done in December. So what was that? That was 8 months between them. Very similar experience with the operation, and I knew exactly what was going to happen. I was a little bit more anxious because this is my right hand, and I am incredibly right-handed, so I have to admit I was slightly more apprehensive. Again, didn't feel the a local going in. That was, I'm not going to say pleasant, but it was much better than I thought, because everybody said that can be quite uncomfortable. Didn't like the tourniquet again, but it didn't seem to be up for quite so long. And the only problem I had is with this one, again, the bulky dressing, again, it was all over within 30 minutes, and I was home very quickly. I found it much more difficult to manage with this one in a bulky dressing. And also this one was much more uncomfortable that afternoon and evening, to such an extent I had to take pain relief. I can't tell you why, because I'm sure this one was worse. And Miss Fuller had commented on them both, saying that it looked congested and irritated. But this one just had a really, how will I describe it? It was quite burning for the first few hours when it started to come back to life. And then it was really painful in the incision site, that I had to have some pain relief, and it didn't stop me sleeping that night, but it certainly slowed it down. And then again, the following day, I had to take some pain relief, and my fingers were more sore, and it was more difficult because I'm so right-handed. Took the dressing off as the other one. But even though I had pain, the tingling had gone, and I knew I could feel my fingers. So I knew it had been a success. It was just more painful at the first 24, 48 hours. But then it pretty much followed this one, in that I realise I can't brush my teeth with my left hand. It makes life very difficult, but you muddle through. The range of movement came back quickly. As I say, the sensation and tingling the sensation came back immediately, and the tingling had gone. It took longer to get the power back in this one because it's my main hand. Again, I didn't like leaning on it, and occasionally, let's say I'm leaning on a rough, uneven surface, I don't like it, but on a smooth surface, I can do a press up on it, and it's absolutely fine. I can go mountain biking, and my son's taught me to jump, and it doesn't hurt them. I don't get any tingling. I just don't like uneven surfaces. But I had to I took 4 weeks off with this one just because it was my main hand. When I first went back to work, I wasn't very good at, not that I have to do this very often, every so often I have to adjust crutches. Found that really difficult, and lifting notes just because of the position they're in. But it didn't take long. But what I found was I wasn't clumsy. It wasn't me just getting older, and I could feel my fingers. So I knew it had been a success. And I actually use them as an example now for patients when they say, oh, I don't know, or I might wait till it gets a bit worse, or well, they're no longer painful, I just can't feel them. And then I say to them, well, if I was you, I'd have it done more quickly. Well, I'd have it done sooner rather than later, because as soon as you get permanent numbness, the chances of recovery are much smaller. So I'm delighted I had them done. I'm a real advocate of the surgery. I quite happily show them my scars, which so one's over a year now and one's only 7 months. You can barely see them, and I know it's worked. So I'm delighted, and I'm no longer worried about not being able to feel things or using suture removal stuff or scalpel little blades when I'm trying to cut sutures, because before I wasn't convinced I could feel them. So I'm absolutely delighted. So I'm really pleased I had it done. There you go. That's it in not a nutshell. That's quite a long spiel.